I want to tell you something that's going to sound backwards. If you're over 60 and you're trying to lose the fat around your middle, doing more exercise might be exactly the wrong move. I know how that sounds coming from a pharmacist. You'd expect me to tell you to push harder, train longer, count every calorie. But stay with me, because this isn't about willpower, and it isn't about how hard you're working out. It's about a chemical most of you are making too much of, every single day, quietly, without a single symptom to warn you. And one of the simplest tools you have to manage it isn't a pill, and it isn't a harder workout, it's a walk. By the end of this video, you'll understand exactly why that's true and what to do about it starting today. As a geriatric pharmacist, this is a pattern I see constantly in patients past 60, especially those managing blood pressure, prediabetes, or long-term anti-inflammatory treatment. Again and again, patients tell me
some version of the same thing. I'm eating less, I'm moving more. And the weight is still sitting right here.
The belly. Most of them assume the fix is simply more effort, more cardio, more restriction, more discipline. But your body after 60 doesn't just respond to calories in versus calories out the way it did at 30. It responds to a stress hormone called cortisol, and research published in the Journal of Clinical Obesity has already established a direct link between chronically elevated cortisol and exactly this kind of midsection fat storage. This one isn't a theory, it's a documented mechanism, and once you see it, you can't unsee it in your own patterns. How your body produces, uses, and clears cortisol changes significantly as you age. It changes again depending on which medications you're taking, how well you're sleeping, and how much unmanaged stress you're carrying day to day. That's what I want to walk you through today, not another generic move more message, but the actual chemistry behind why the fat around your midsection may be behaving the way it is and what specifically helps. Here's what most seniors don't realize. Cortisol isn't just the stress hormone in some abstract sense you've heard mentioned on television. It's a signal, a very specific one. When the body senses a threat, whether that's a stressful phone call, a poor night's sleep, a health scare, or simply sitting still under prolonged tension, cortisol tells your body to prepare for that threat. And one of the ways it prepares is by storing fat in one particular place, viscerally, around your organs, concentrated in your midsection. And here's the part that quietly complicates things for a lot of you. A number of medications commonly prescribed to adults over 60, corticosteroids like prednisone for inflammation or autoimmune conditions, certain hormone therapies, and even some medications used for chronic pain management can elevate baseline cortisol activity or interfere with your body's natural ability to regulate it. So if you've ever wondered why the weight seems
to concentrate stubbornly in your midsection no matter what you eat or how often you exercise, this may be part of what's quietly happening beneath
the surface. This isn't something your prescribing doctor is hiding from you. It's simply something that rarely comes up in a 15-minute appointment focused on your primary condition. Nobody sits down and explains the cortisol piece because there usually isn't time. And here's the part that surprises most people, and it's the second thing I want you to hold on to as we go. The way we're often told to fix this, pushing harder. In the gym, adding more high-intensity training can, for some patients, make the underlying chemistry worse rather than better. In a moment, I'll show you exactly why, and it may change how you think about your entire workout routine. Let me walk you through an illustrative scenario. Call her Margaret, 68, a retired school teacher. Margaret has been on a low-dose corticosteroid for rheumatoid arthritis for about 3 years. She walks her dog for twice a day, watches her portions carefully, and still describes her midsection as the one part of my body that simply won't listen to me anymore. When we talked through her daily rhythm together, what stood out wasn't her diet. It was her stress load. She was serving as a full-time caregiver for her husband. Her sleep was fragmented most nights, and she had a habit, an understandable one, of sitting for long stretches whenever she felt overwhelmed, rather than moving through that feeling. Her body was producing cortisol steadily throughout the day with very little outlet to actually use it. We didn't add another supplement. We didn't change her medication without her physician's involvement. That decision always belongs to her care and team, not to a conversation like this one. What we did was build in short, deliberate walks, particularly after her most stressful moments of the day and after her largest meal. Within a few months, without changing anything else about her routine, she noticed her clothes fitting differently through the month. Not dramatically, but noticeably. Margaret is a composite of patterns I've seen repeatedly in my practice, not one specific patient, and her experience
isn't a guarantee of any particular outcome for you. But the underlying mechanism is worth understanding because it may apply to you too.
So let's talk about why this actually works, because the mechanism is genuinely elegant once you see the whole picture. And this is the part I promised you a moment ago. When cortisol rises and stays elevated, it does two things that work against you simultaneously. First, it redistributes fat storage. Cortisol suppresses what's called brown fat activity, a more metabolically active form of fat tissue that helps your body burn energy more efficiently. So, the elevated cortisol doesn't just add fat in the wrong place, it also slows your body's underlying ability to burn it. Now here's where walking comes into the picture and why it behaves differently than a harder cardio session. Intense exercise, particularly high-intensity interval training, can actually raise cortisol further in the short term. For some patients past 60, especially those already carrying a high stress load or managing inflammatory conditions, that additional spiking can work against the goal rather than toward it. Walking, by contrast, has been associated across multiple studies with lowering cortisol, activating what's known as your parasympathetic nervous system, your body's rest and digest state, and signaling safety to your nervous system rather than adding to the demand. It's already under. This is genuinely one of the patterns patients bring up with me the most. The frustration of working out harder and then seeing less. Once they understand the cortisol piece, that frustration usually starts to make sense for the first time. There's also a smaller, less obvious mechanism worth knowing about, tucked away in your lower leg, the soleus muscle in the back of your calf. A 2022 study published through Celebrate Research found that a simple seated calf raise movement, essentially rising up onto your toes repeatedly while seated, meaningfully reduced the post-meal rise in the For those of you managing blood sugar alongside blood pressure or cholesterol, that detail matters, because steadier blood sugar generally means steadier insulin and less pressure toward fat storage overall. Put those pieces together and you start to see why just walking isn't a lesser strategy compared to intense cardio. For a body under chronic stress, it may actually be the more precise one. Now, in a moment, I'm going to give you the exact protocol I walk my patients through, 5 specific steps, including one you can do sitting down, no walk required. But before we get there, you need to understand one more thing. Not everyone who already walks every day is getting this benefit. And if that's you, the next part is going to explain why. So what does this actually look like day to day? I want to give you something concrete, not another vague instruction to move more. First, a 10-minute walk after your largest meal of the day. Not a power walk, not a fitness challenge, just a walk at a comfortable pace. This gives your body a chance to use the glucose from that meal before it has worked. Second, if you can't get outside, bad weather, mobility limitations, a long appointment, a stretch of pain that keeps you indoors, the seated soleus raise is your backup tool. Simply rise up onto your toes repeatedly while seated for a minute or two, several times through the day. Third, anchor one walk to the morning, ideally within the first couple of hours after waking, when your natural cortisol rhythm is already active. This helps your body put that morning cortisol surge to use rather than let it accumulate with nowhere to go. Fourth, if you're currently doing intense cardio several times a week and you're not seeing the results you'd expect, this is worth raising with your pharmacist or physician, specifically whether swapping one high-intensity session for a walk might better suit your current medication regimen and your current stress load. That's why a conversation to have with your care team, not a decision to make alone based on a video. And fifth, this one costs nothing and carries no side effects. Simply track your daily steps, not to chase a number, not to turn it into another source of pressure, but to understand your own rhythm and notice what a typical day actually looks like for you. None of these 5 steps require new equipment, new supplements, or a gym membership. That's intentional. The goal here is something sustainable, not something else to add to an already full plate. Now, I know what some of you are thinking, because I hear it constantly in my practice. I already walk every single day, and nothing has changed. Let me explain why that might be. This is the piece I mentioned a moment ago. If you're walking regularly, but your overall
Cortisol load is still high from other sources, poor or fragmented sleep, a medication that affects your stress hormone regulation, an ongoing caregiving burden,
or chronic pain that isn't well managed, walking alone may only be addressing part of the picture. This is exactly why I always recommend discussing your full medication list and your daily stress pattern with your pharmacist, not just your walking routine in isolation. Sometimes the missing piece isn't for more walking. It's identifying what else is quietly keeping cortisol elevated in the background. Does this mean I should stop my cardio workouts? Not necessarily. And please don't stop any exercise routine without talking it through with your physician first. This isn't about eliminating cardio, it's about discussing whether a continued high-intensity training is right for you given your current medications and stress levels, and considering walking as a complement rather than assuming more intensity is always better. Will walking alone get rid of visceral fat? The research consistently suggests that walking supports healthier cortisol regulation and can help manage visceral fat storage over time. It's one meaningful tool among several, not a guaranteed singular fix, and results will vary from person to person. I'm on a corticosteroid long-term. Am I just stuck with this? Talk to your pharmacist about whether continued use, dosage timing, or complementary lifestyle strategies might help alongside your treatment. This is a conversation to have with your care team, never something to stop or adjust on your own. Does the time of day I walk actually matter? It can. Morning walks tend to align with your body's natural cortisol rhythm, but a walk at any time that helps you use accumulated stress is better than no walk at all. Consistency matters more than perfect timing. Here's the piece that I think matters most, and it's the one most videos on this topic skip over entirely. Walking isn't just burning calories, and it isn't just a smaller scale substitute for a harder workout. It's telling your nervous system quietly and repeatedly that you are safe. And for a body that has spent years in a low-grade state of chronic stress, whether from caregiving, from managing a chronic condition, from disrupted sleep, or simply from
Getting older in a demanding world, that repeated signal of safety may be doing more for your midsection than any workout intensity ever could.
That's the part most seniors don't realize is happening inside their own bodies every single day, without a single symptom to announce it. You now know something most people your age don't. You know that the fat sitting stubbornly around your midsection may not be a simple failure of effort or discipline. It may be a chemistry your body is trying to manage, one that certain medications can quietly complicate, and one that a simple 10-minute walk can genuinely help regulate. Here's something you can do today. Take one walk after your largest meal, and if you're on a long-term medication like a corticosteroid, bring this conversation to your pharmacist at your next visit. Ask specifically whether it affects your cortisol regulation and what that might mean for your particular situation. You deserve to understand what's actually happening in your own body, not just what to eat less of or how much harder to work out. Now you do.